The content, views, and opinions expressed in the following program are those of the producer and do not necessarily reflect the views and opinions of the City of Bremerton, BCAT, their officials, or their employees. Welcome to Afternoons with Ash. Today, we're going to meet somebody whose work is as vital as it is transformative. I'd like you to imagine a world where every child is given a chance to thrive, every parent feels supported, and every family has access to the care that they need. My guest today isn't just imagining that world, she's building it. Gabreiel Outlaw-Spencer is a tireless advocate for maternal and infant health and a leader at the Kitsap Public Health District. Through her work with Black Infant Thrive, she's addressing health disparities head-on, creating pathways to equity and opportunity for families right here in our community. Gabreiel's efforts are deeply rooted in her educational background in early childhood and elementary education, as well as her role in community health advocacy. She's also the author of the My Self-Love ABCs, which is a children's book that's inspiring the next generation to grow with confidence and self-worth, one letter at a time. Join me as we explore Gabreiel's journey, her transformative work at KPHD, and how we can all support the mission for equitable health outcomes for every family. Let's get this started. Gabreiel, thank you for joining me today.
Thank you for having me.
I've been really excited to talk to you about Black Infant Thrive, in particular, your work with KPHD, the Kitsap Public Health District. You have a very exciting background, and your journey to where you're at today, I think is really important to share with people. I was wondering if you could tell me a little bit about the pivotal moments or experiences that have shifted your pathway towards becoming a health advocate and an educator with Kitsap Public Health District.
Yeah, so my journey started pretty early on. I've always been like a provider and caretaker for people in the community as well as my family. And so it started with like babysitting, and that moved on to childcare. And then I went to school for early childhood education, and that really like got my foundation for like the love of early childhood education. So that's like working with infants and then really studying like the developmental milestones. And then I stayed in that role for about 12 years. And then coming out of that, I decided to finish my master's. And then I was like, early childhood education is great, but like, I want to see what elementary education is. And so I went on to be an elementary teacher for kindergartners. And I loved that, but I still miss the foundations of like early learning. I missed like that one-on-one with like infants and the families and just being able to like help them in that way. And so I left elementary education and I went back to infants. And then I was still missing something. And then the role came up at KPHD for Black Infant Health. And it was a way where I could create a brand new program and really just figure out like what's going on with the community, how I could bring my experiences to it, and then create something that was more meaningful. And so that kind of brought me into where I'm at now in infant mental health and just creating things that are ongoing in this community and combating like struggles that are going on in real time.
Anybody who knows you, I think could attest to the fact that you just love kids, you love the family, you're taking care of, folks, from birth. And, it's very admirable what you do. I'd love to hear more about, this program, Black Infant Thrive. You've found a need that exists within our community that I don't think a lot of people are aware of, and that was, one of the things that drew me to speaking with you. This is such a big issue that I don't think most Americans are aware of, the maternal needs of Black women, the issues that arise during childbirth. It's very interesting what you do. Could you give me, a broader description of Black Infant Thrive, why it's so important in our community?
Yeah, so statistically speaking, Black women are 2 times more likely to die during childbirth for things that are preventable. So 80% of those things that they're dying from, we can combat within the community with just like education or providing them resources or just being like a leading hand. So that's kind of where this program came from, was just like seeing a need, realizing that like there are things that we could do and address in real time, whereas instead of ignoring it and things like that. And so the program has been running for about a year. It's been very interesting where I thought at the very beginning, I thought it was going to be like something that like I start right away. I know what the needs of the community are. And it ended up being something where I had to like dial back and really like do outreach and be in the community and get to know my partners and get to know like what the actual needs are. Because me, myself, I'm a mother and I know what I was missing and what I wanted. But as I'm talking to others, I'm realizing that it's so much broader than what I was thinking. In terms of like access to healthcare, like really the socioeconomic factors and the environmental factors are really playing into like the families and their stressors. And I can try to help mitigate those through resources and things like that rather than just address the bigger problem of access to healthcare. And so, yeah, that's been my journey so far.
In your statement here, you mentioned a couple things I'd like to touch on. Number one, the disparities. Tell me a little bit about these issues that, as you stated, are solvable. What are these issues that are addressing these ladies and these children, and how can we address that?
Yeah, so birthing families as a whole and as an individual basis have been, so I have a survey right now which is tailoring to Black birthing families 3 and under who have given birth either in Kitsap or got prenatal care in Kitsap, some type of form in Kitsap. And so it's a way to figure out in real time, like in the past 3 years, what has your maternal experience been? What resources have you used? What has communication been like? Have you experienced any barriers, whether it's dental or medical? And then what would you like to see in the community? And a lot of that has been like the families feel isolated. They feel like the resources weren't in a timely manner. They feel like the things that are already in Kitsap aren't helping them. And then the things that they need or see in other communities, they seek out. So like a lot of the families are going to Tacoma or Seattle to get resources when that's a barrier in itself for transportation. So how could we create things here or things that are already existing? Like how can we bring those up or uplift them or partner with so that families aren't feeling like they need to travel or have another barrier when we have so many beautiful things in Kitsap County?
Yes, but could you tell me about the medical side of it?
Yeah.
What's causing the increase in deaths among these women? What is it that they're missing that we need to provide for these women so that we're not seeing such high mortality rates? And when I say that, I would like to draw attention to the fact that here in Kitsap County we do have a higher percentage. If I was reading the stats correctly from KPHD's website, what was it? Some 10 in every 100,000 women are dying from things that are preventable. Is that correct?
Yeah, the overarching, and that really is like in Kitsap County, a lot of it is trust and miscommunication. And then the big picture is the fact that we have a lack of OBs. And so a lot of women are either not being seen soon enough or they're receiving care like in Tacoma or Seattle. So because of the lack of OBs in Kitsap County, families are frequenting the emergency room a lot because they can't get in a timely fashion or they're outsourcing, and so they're giving birth in other places. And so in Kitsap, there are things that we can do. There's supports that we have that can kind of like mitigate those things. Like we have the pregnancy and parenting support line that can kind of get you in to resources and kind of navigate you through that in a timely fashion if you don't know what's already existing. There's a lot of like medical supports and interventions and just ways that people could be. There's doulas that are up and coming, which is a support for families where if you're not able to get in, you can at least get that education portion and that support, because a lot of the supports that needed are just like that physical, that mental, and just that person that you know that's there for you, which is helping in between rather than just like the medical interventions where like maybe you don't need to see a doctor right away, but maybe you just need someone to talk to or someone to work this out. Or if you're having the stressor, someone to just say, you know what, I'll just come and I can help you like with your household needs or figure out like your childcare or help you with those things. So it's like the smaller things that lead up to the bigger stressors as well in the program. And we're seeing a lot more than that, which is the things that are preventable.
I understand that education is also a huge issue, and that it translates, a lack of education can translate into a medical issue. In your experience, educating these women, do you see that there are large disparities in within the Black or marginalized communities versus, other communities in regards to that education, fundamental knowledge about, their bodies and things that they might need that could lead to preventing some of these high mortality rates?
Yeah, definitely. Education plays a big piece in it, and that's from knowing who your resources are, how to utilize resources, and then like in what timely fashion do you need to address these things? Because there's sometimes where there's a timestamp. You can only access, like, for instance, nurse family partnership. It's 29 weeks or less. And if you're over 28 weeks, that's not a program that's going to be a fit for you. But if you know these things in advance or as soon as you get pregnant and you're given all these pamphlets and resources and you're able to utilize these in a way that, or someone talks to you in a way that says, like, here's these resources, these are exactly what they are, when you need to contact them, or you have someone to navigate it, like the pregnancy and parenting support line. You have that access to where, like, the educational piece isn't a barrier, and you're not getting to the end of your term or pregnancy and then you're just like, oh, well, what do I do? Or now you want to call to people and then you're not able to receive those resources.
You've mentioned resources, and I think that's a really interesting side about what you do with the Kitsap Public Health District. I've spoken in the past about my experience being a young father and needing access to resources and things like that. You guys have a pantry, you have a closet. Tell me a little bit about the resources that Kitsap Public Health District is providing to women who are in need, and fostering family. Tell me a little bit about that.
Yeah, so there's a pregnancy and parenting support line. I feel like that's the biggest one for families to kind of get in contact with. They're able to like navigate mental health needs, home visiting, resources within the community. That's kind of their niche to kind of be in the know about like relevant stuff. They update about doctors, childcare facilities, housing needs and things like that. So that's like the biggest one. There's nurse family partnership, which is 29 weeks or less, but they're also able to get you a nurse that gets to come out to you. So you get an actual nurse for up to 2 years.
That's unbelievable.
Yeah, it's one of those things where like not enough people know, and then when they do find out about it, it could be too late. And so that's a big thing. And then there is my program, which is nice because I've been doing some really cool things in the community where I get to offer resources. Like I had a maternal health showing where I got to actually tell the community about like the reason why behind what I'm doing. So I got to see in like other states and other cities their maternal health disparities and how they kind of combat it as a community, rather than because a lot of people think it's like funding, and sometimes it's not funding. It's about like enough community input, enough people wanting to combat this to come together. And so that was one of the first things I did. And then I did a wellness event because a lot of the people were saying that they didn't want to leave their children, but they really wanted that community support. And they wanted to have a time where they could just like talk together, be in fellowship. We did some hair care. We talked about mental health, and then we ate some really good food. So that was the second thing. And then ongoing right now, I have a book club where families can come. We read a book, we fellowship together. We get to talk about like things that are going on in real time. And then this Saturday, the 14th, we have the Just Essentials event because a lot of the information that I've been getting has been like, it's winter time, so I don't have diapers, I don't have wipes, I don't have the things I need to sustain until the next year, or even if that's like deodorant, toothpaste, and things like that. And so I figured, what could I do in my program that would help that, but also advocate for the family's needs and let them know that like, this is something that we could plan for and something that we could talk about. So we're talking about finances, we're talking about budgeting, as well as providing those families with the essential needs going into the new year. So I'm really excited about that.
I love this. It's a holistic concept. You're addressing not just the physical needs of an individual, but everything. Speaking of the essentials, y'all, I watched one of the deliveries come in at diapers, and it's just a beautiful thing to see. these stacks of supplies coming in, and knowing that, there's a family out there who's going to need these items and they're going to be receiving them. You have an event coming up. Tell me when that's going on.
So the book club is every Thursday, so it'll be tomorrow going on to February 6th. So every Thursday, it's from 3:30 to 4:15.
Yeah.
You get to come with your children. It's a great time. And then Saturday, December 14th, is just the essentials.
Just the essentials.
Just the essentials.
Yeah. So what all can someone expect when they show up at Just the Essentials? That's done. That's a partnership between you, Doc Loves the Kids, and Rosenblum, correct?
Yes, and House of Hope.
And House of Hope.
Yes.
Okay. And what could one expect? When they show up there, you can show up. You need diapers. You need wipes. What else? What else is going down?
Yeah, so we're going to talk financing and budgeting. So basically wants versus needs, because a lot in families, like there's things that you need, which is probably diapers, wipes, formula, food,
Yeah.
the essentials. And there's things that you want too, which are great, but also like how can we have a balance between both? So we're talking about that. So we have young families as well as older families that are experiencing the same things.
Yeah.
And so we're just trying to mitigate that and bring it to a ground level. And so coming in, we'll talk about finances, budgeting, we'll have some refreshments. It'll be a fun time. We have some games. Kids are welcome, so we'll have like a corner with toys and everything for the kids as well. We'll have some food. There'll be 2 hour shopping window for families to come and shop. So there's like diapers, wipes, shampoos, deodorants, all the things that they'll need. And then we'll kind of like create a budgeting sheet for the things that they have, like how much would this have cost in real life if you're able to do it. So like families don't have to pay anything, everything's free,
Yeah.
but it's just the idea of like, if I was in the real world, what is my want versus need for everything that's here today?
That's so cool that you were able to put this together, and just all the things that you're doing for the community right now are wonderful. The more that I pry into the story, the more research that I do, it's hard to believe that families are suffering so much out there. Even in a place like Kitsap County, and it just means so much to have folks like you out there, doing what you're doing. And speaking of folks doing things, you mentioned the community's engagement being vital for these programs. We talked a little bit about the survey. Tell me about that survey, and the Black Infant Thrive webpage. How can people get involved? How can they be part of that survey?
Yeah, so the survey is still open right now. I have 60 participants. That's the goal. I'm currently at 30, so we're 50% in. But the idea of the survey is to really get an idea of like what's going on in real time. And so it's 3 years and under, and some of the data that's pulled has been like 2020 or 2021. So realizing that in current times, like someone can give birth right now and take the survey, and I can figure out what went well, what didn't go well, what was their experience, and what would they like to see out of the program, as well as if they were able to access resources. And if they say no, or if they have any type of troubles, I'm able to contact them right away.
Yeah.
And then I can reach out to other partnerships and say like, hey, this person said this is going on. What could we do as a whole to mitigate this, or how could we fix this going forward? And sometimes it's broader things, but for like the little things, if they're just saying like the communication didn't go well, or I wasn't able to see this OB, and so I went outside of Kitsap, then I can contact the OB, or I can get in partnership with someone else, or like the Pregnant Teen Pregnancy Support Line, and say, there's this barrier. Has anyone else seen this? And then kind of combat it that way. And so community input has been the biggest thing. It's been driving this program. So when they say, I'm having trouble finding people just to like be around to talk with, I can say, oh, there's a mental health support, or like, oh, there's this. And if I can't get them into that, then I create things like the wellness event. I brought in mental health supports where we talked about it as a whole group. We had the peer support, we got to talk about it as one another. And then that was a way where maybe if they don't have insurance or if they don't have these things, I can bring it to them. And then we could talk about it as a whole and kind of like mitigate that. And then going forward, I can recognize that as something that like people are seeking this in a group setting. And how could I create that going forward?
In your experience, why is it so important for folks to have somebody that they can communicate with on these issues?
Yeah, isolation is real, and relationships are one of those biggest protective factors, where if you talk to someone or see someone, it kind of builds up that rapport where you kind of feel like loved and seen, and you know that you're valued, and you know that there's someone that's checking in on you
Yeah.
that appreciates you. But when you have that isolation, sometimes you don't get that. So I'm finding in when people are seeking resources and maybe the resources don't work out, they don't know they exist, they feel like they just stay in that realm, and that's where a lot of like postpartum and things come
Yeah.
about when they first have children.
Is the isolation, is it infectious? Do you find that when folks are in that place, that it spreads, it becomes cantankerous, that it can contribute to negative thoughts that go beyond just that, initial isolationism? What I'm saying is, without intervention, do you feel that it has the potential to become cancerous for these individuals who are feeling that way?
I think it becomes the norm. So I think the more people talk about that there's no supports within Kitsap or they're not seeing this, a lot of people move from like southern states and this and that where supports are more heavy, or these people that look like them. So when they come here, they're like, oh, there's no black owned this, or there's no black supports, or there's no this or that going on. So I feel like that becomes the norm where people just know that like Kitsap County doesn't have these things. But there's a lot of beautiful organizations that are up and budding and that I'm trying to highlight and partner with to make sure that when they say, there's no in the Kitsap County, I'm like, actually, there's a program that's up and coming. I would love to hear your input. There's also this partner program that does this. They have these stipulations, but there are things in Kitsap that are up and coming. So I'm trying to like highlight that in a way where it brings people out and they're not feeling as isolated.
Tell me real quick, because we're coming shortly to the close, but I would like to know about the role of collaboration in your program's success. Maybe you could tell me about how individuals could get involved, become part of your organization, or help spread the word.
Yeah, collaboration is the biggest part. And I found out early on, like there are so many beautiful organizations that are already doing great work.
Yeah.
And so just highlighting them, figuring out how we can intertwine, because I don't want to create the wheel. I want to like get on the wheel and make sure that we're in together. Because if I don't have to do that work, if they're already doing that, like why replicate it? And so collaboration has been the biggest thing. I've been so excited at partnering with a lot of the different organizations in community, like Doc Loves the Kids, Rose and Bloom Co., House of Hope, the Marvin Williams Center has been really great. Kitsap Strong has been amazing. Like, it's just been so many different opportunities. From Slavery Initiative, like I could keep going. Like being in the community and doing outreach, I've been able to partner with so many community members who like provided tidbits into like what has been done before, what worked well, what didn't work, and where I could go from there with the program. And so it's just been an amazing ride. And to get in contact with me, my email is always open. My phone number is always open. If you have an infant that's 3 and under, please take the survey as it'll end in the next couple weeks. From that, we'll have a big community share out where we'll talk about like what we're seeing in Kitsap, what the families are experiencing. But it's an ongoing. Without community involvement, the program's not going to move forward. So it's always just like I'm listening what's working, what's not working within the own program, and then just moving forward.
Well, I love what you're doing. I know that your name is starting to blow up in the area. You mentioned Marvin Williams Center. I know Dr. Lillian over there, and her work with Black children, making sure that mothers thrive and that we bring down this mortality rate. As you said, it's something that can be achieved. The issues that are affecting these women are solvable. And, I can't thank you enough for the beautiful work that you're doing here in our community. And, I know we're going to be seeing a lot more of you and hearing your name all over the place. So, I'm really glad that we were able to have this conversation today and, highlight some of your efforts. So thank you so much for being here today.
Thank you for having me.
Today's conversation has been a powerful reminder of the importance of equitable health outcomes for all families. Programs like Black Infant Thrive are paving the way for systemic change, but they need all of us to succeed. If you were inspired by today's discussion, visit kitsappublichealth.org BIT to participate in the survey, explore resources, and learn how you can contribute to this mission. And don't stop there. Organizations like Doc Loves the Kids, Rosenblum, and the Kitsap Community Foundation are doing incredible work to uplift families across our region. Gabreiel, thank you for sharing your story and your vision with us today. And to our viewers, thank you for tuning in and being part of the solution. Remember, every action counts, and together we can create a brighter, healthier future. Until next time, keep dreaming and doing. This is Ash, signing off from Afternoons with Ash. Catch you next time.
You can find all of our episodes on our YouTube channel and catch the live broadcasts on BCAT, as well as all the extras at Afternoons with Ash Black on Facebook.